So my name is Dr. Amr Salam. I'm a consultant dermatologist in London at the St John's Institute of Dermatology at Guy's and St Thomas's NHS Foundation Trust and One Welbeck Skin Health and Allergy. I'm also an honorary senior lecturer at King's College London. I think I realized quite early that whatever career I chose needed to be, firstly, interesting, secondly, challenging, and thirdly, rewarding. And being a doctor kind of allowed me to marry up my love for science with a career that will always keep me on my toes with the constant advances in medicines and techniques. But I think most importantly for me was being a doctor allowed me to make a real difference to people's lives by kind of diagnosing and treating their medical conditions. And it was that rewarding aspect that really drew me into becoming a doctor. So I remember all too well suffering with bad acne as a teenager. And I remember just how much of an impact it had on my self-confidence. I would hold my hands over my face when speaking to people. I hated having photos taken. And sometimes I didn't even feel like socializing or going out. And one of the most rewarding aspects of being a dermatologist is that you can make a huge difference to patients' quality of life by treating their skin conditions. And whether it's a patient with eczema who simply can't get any sleep because of their itch, or someone with rosacea who no longer wants to socialize because it makes their face go embarrassingly red, or a patient with psoriasis who feels too self-conscious to take their kids swimming as people stare at their skin, there's nothing more rewarding than giving patients their lives back. Well, as doctors, we conduct anonymous patient surveys regularly, and based on anonymous patient surveys, I would say that there are certain things that I found my patients often feed back to me. Firstly, my patients tell me that they feel like they've truly been listened to. I always take the time to hear the full story of their skin disease from beginning all the way up to the present day, and often the difficult journey that they've had to endure throughout. The second thing I would say is empathy. My patients tell me that after a consultation, they feel like a weight has been lifted off their shoulders just by talking to someone who understands the far-reaching impact of their skin disease and what this does to their day-to-day lives. And I guess finally, my explanations, my patients tell me that after consultation, they feel like they truly understand their condition a lot better. I always take the time to explain their diagnosis, answer any questions that they have, and clarify any aspects of their treatment plan. I don't have a mantra or catchphrase per se. I'm not a game show host, unfortunately, but I guess if I had to choose something, I would probably say patient-centered care. I believe it's so important to respect each of my patients' unique personal values and tailor a treatment plan specifically to their needs. There is no one size fits all in dermatology. And I also provide them with the information and education that will give them the confidence to manage their skin condition way beyond our consultation.